In today's video, I want to talk about menstrual cycle disorders that you shouldn't neglect. And you may be asking, why do I want to talk about this? Is actually to complete this series of menstrual cycle that I started a while ago, and I have other videos that I have in stock for that series. But because of lack of time, I decided to do this as a live video. So if you don't watch the live when I was going live or when I'm doing it right now, then highly welcome to the replay. So guys, today I just want to talk about 1 2 3 4 5 6 7. I want to talk about 7 menstrual cycle disorders, or 7 menstrual cycle abnormal signs and symptoms that when you see, you shouldn't ignore. So if you're new to my channel, my name is Amara Ozadigwe, a registered nurse midwife practicing in Nigeria. So I use this platform to share a lot of things pertaining to health, but for some time now it seems as if I took a break because of motherhood. I gave birth. Even right now I'm breastfeeding my baby. So let's go right straight into the video. This video is going to be as brief as anything. Then the first thing that you need to look out for in your menstrual cycle, for those that may be asking, I've done a video on menstrual cycle, how to calculate a menstrual cycle, how to know when you're ovulating, how to calculate your ovulation, as well as, excuse me, they just brought light. Let me switch on the light. So guys, just like I was saying before they brought the light, I was talking about the things that you should look out for in your menstrual cycle that you shouldn't neglect as a young lady. So the first thing there is, okay, before then I was talking about I've done video on how to calculate your menstrual cycle. I've also done video on how to calculate your ovulation and also how to know that you are ovulating. Then I also did a video on how to know your safe and unsafe period. Your safe and unsafe period, that is your fertile and your non-fertile period. So but today we are going to just look at abnormal things that now you've known how to calculate your menstrual cycle and other things. There are other things that may be happening in your cycle that should give you concern if you see them. Then the first one here is the absence of a menstrual period, what is known as amenorrhea. Say you're a young lady watching this video and you've seen your cycle for the past month, but you just noticed that this month or just the past month that you didn't see your cycle and you didn't see your flow, and you were like, what could be the problem? What could be the problem? So you decided to wait maybe to the middle of the month to wait to see if you can see your period again, and the middle of the month have passed, a month have passed, and you've not seen your period. So once there is any absence of your flow, even if it's just for a month, and you know that you aren't stressful, there is nothing that actually pushed your period to delay or to prolong, then you need to go and see your obstetrician. You need to go and see a doctor, an obstetrician. I'm feeling hot here. So that is the first thing. Once you see amenorrhea, once you notice amenorrhea and you've ruled out that you're not pregnant, please don't take it lightly. Then the second thing also is heavy flow. There are some ladies that their flow is not heavy, their menstrual flow is not heavy. They know that their flow is somehow between, like, they don't use much pad in a day, they can use about 2 or 3 pads, but to show that your flow is heavy in a day, you are using about 7-8 pads. So, and not just that you're using more pads than you used to do, you notice that this pads, it used to full within 30 minutes, within an hour, your pad is already filled up. Then you are having heavy flow, and it's a thing of concern. You need to go and see your medical practitioner. You need to be adequately checked to know what is actually causing the heavy bleeding. It's not something that you say, oh, let me just manage. You don't manage, because the blood that is coming out from you is real blood. There is nothing wrong with the blood coming out with you. So it's your real blood that is coming out. So you need to go and check yourself in order not to become anemic. Then the third thing is when you have scanty flow. So it's just the opposite of the other one. You know that your normal flow, but now your flow is becoming scanty. Not just that it's becoming scanty, it will come today and it will stop tomorrow. Unlike your period that normally comes and stays about 3 days or 4, then it's a thing of concern. Then there is something I forgot to say about the heavy flow. That heavy flow, let's say that the flow is now becoming heavy and prolonged flow, is becoming heavy, and instead of stopping on the 4th day, then it will move to 5, 6, 7, 1 week, 2 weeks flow. It's not something I just need that to sit down and pray over. You pray over it, then you go and see your medical practitioner. Then the fourth one is clots in your period. It's only ladies that will understand what I want to say now. The way that your period looks like each time that the period is coming, but now you are noticing that there is something like clumps, or what we call clots, in your period, and it comes heavy and it pushes out. Guys, if you're a lady here, you need to be checked to know what is causing that. Then another one is bleeding in between period. When I talk about bleeding in between period, let me just see how to explain this, because the last video that I did, someone was asking me, nurse, I just finished watching your video and my period came last week, last month, so date, and we are on the same day this month, but I haven't seen my period. What am I going to do? So I know what I told that person, but I'm talking about you saw your period last week and the period flowed for 4 or 5 days. Then after a week or 2 weeks later, you started seeing another period. So that is bleeding in between period. It's not even up to say 20 or 28 weeks, depending on the number of your cycle days. So guys, if you notice that you're having bleeding in between, and you may be asking, how can we call menstrual flow bleeding? Yes, when it moves from what it used to be to excessive loss of blood, then we call it bleeding. So when there is bleeding in between period, it calls for attention. And when I talk about attention, sometimes it's not something that is serious. It may actually be maybe your hormones. There is a way women body do behave. So it may be your hormones, it may be something else, it may be what is around you, it may even be what you're eating. So we don't even know how to say that this is actually what is causing your problem or your current issue. So the best way to do that is to visit the doctor so that you be adequately checked. Then another one, or this one is the 6th one, is when you have irregular menstrual cycle. Irregular menstrual cycle is one of the commonest problems that most women experience, as in their period becomes irregular. It will come this month and it will not come again till the next 3 months, and this woman know very sure that she isn't pregnant. So when you have irregular menstrual cycle and you've monitored your cycle for the first 6 months or for the first 12 months, and you notice that your cycle is becoming irregular, it needs adequate attention. Sometimes what will be used to correct it may be just a medication, it may be just change in lifestyle, it may even be your hormones. Maybe your hormone, one of them is higher than normal or is lower than normal. So there is no way you can sit in your house and say that this is what is causing you irregular menstrual cycle. So the best way to do that is when you go to hospital to be adequately checked, because there are so many things that can cause a woman to have irregular menstrual cycle. Then another one is when you have obvious abnormal cramps. Menstrual period or menstrual flow sometimes comes with cramps either before the flow or first 2 days of the flow itself. So when you notice this as a woman, that you're having obvious abdominal cramps each time that you see your period, and you don't used to see this before, it needs adequate, in fact it needs you to be adequately checked. Then another thing that I want to add as a bonus, if you notice that each time that you are menstruating, that you feel so dizzy, you feel so weak, if you walk you feel like falling, as in each time the whole environment is turning, you need to check yourself. You need to go and be adequately checked. It may be that you are becoming anemic and you don't even know that. So guys, these are the few things that I just want to point out, and there's a danger. So if you're a young lady watching this video, if you're a mom watching this video, if you're a dad watching this video, a friend, this video is for enlighten, not just for the young ladies but also for the men, because there are some things that you see your friend having and you may not even know that this is abnormal. So you can, with the knowledge that you have from this video, you can use it to help such a person. So I just want to stop here, and we are going to be doing more of live videos because I don't have the time to do videos and edit. So it's going to be more of live. And if you enjoyed the video, just leave a like, leave a comment, leave your questions, and subscribe to my channel if you haven't done that. But for my returning subscribers, guys, I really appreciate. Thank you for always coming back to watch the videos. Thank you for the support. Thank you for everything. So I remain your favorite nurse, Amara. This is me doing motherhood. So there's no time for glam, there's no time for other things that I used to do before. See you next time. Bye. I want to end the video.